Hey guys, I'm Antoinette Pusateri. I'm a third-year resident here at the Ohio State University Internal Medicine Program, and I'm excited to have you join me for a day in the life of the resident here at OSU.
We begin in the sign-out room, our dedicated space where we get the overnight updates from the night team. Before heading to our team room, we must grab a code pager as we are responsible for responding to all codes in the hospital. And of course, we must grab a coffee before tuning in to morning report. Our teams include general medicine and subspecialty inpatient services, made up of 10 to 16 patients with a senior resident and 1 to 2 interns, not to mention the dedicated attending physician, case manager, social workers, pharmacists, and our wonderful med students. It doesn't hurt that we have top-notch facilities with amazing views to inspire us throughout the day. By mid-morning, after pre-rounding, we come together as a multidisciplinary team to see each patient, led by our residents. From the level of acuity and complexity to the experience of the patients themselves, coming to us from downtown Columbus, rural Ohio, or newly immigrated from Somalia to Nepal, there is great diversity in the care we provide. Afternoons on the wards include finishing notes, conducting procedures, collaborating with consultants, and teaching our medical students. One thing is for certain, no 2 days are alike as an internal medicine resident at Ohio State, especially amidst the COVID pandemic. But true to our spirit of innovation, our residents have sought out opportunities to be leaders and advocates for change. Clinically, our residents stepped up to staff the COVID response team earlier in the pandemic and staffed the COVID overflow MICU on the 10th floor here. As part of our curriculum, we are encouraged to not only attend but design lectures regarding everything from social determinants of health to simulated critical care cases in our sim lab. Our schedule enables residents to have the flexibility they need as adult learners to process the wealth of knowledge in the forms most suitable for them. Looks like we just got an admission from the emergency department. We are at the forefront of emergency care with a level 1 trauma, stroke, and STEMI center and a unique oncologic emergency department. Such a structure allows us to collaborate a great deal with our emergency medicine colleagues and our fellows. Fellows are a phone call away and are happy to discuss questions and concerns you may have about the care of your patient. Many fellows go above and beyond to teach, especially in regards to procedures and ultrasound skills. Brutus thinks they're number one. Also number one are our food options. While the resident lounge is always stocked with snacks and caffeinated beverages, you can also get meals from our on-campus bistro, Panera, Au Bon Pain, and Wendy's. What is that thing? Who knows? But what I do know is that there's no shortage of good food here. Now we will hop over to the Ross Heart Hospital, home to our Heart 1, acute coronary, and advanced heart failure services that you rotate on as a resident. Remember that you may find yourself seeing patients at any of our 6 hospitals on main campus in a day, on consults or in response to activations of the emergency response team or Code Blue team. I wholeheartedly guarantee that you will love your time here as an internal medicine resident, as even early in your career, you are looked at as a frontline leader across our hospital system and supported as you develop into the physician you've always dreamed of becoming. So our work is almost done for the day. Time to go back to the resident room to finish last-minute notes and handoffs so that we can sign out to the night team. Our night float system enables us to never take call while we are on service and allows the night team to acclimate to nights for 1 whole month, during which they make critical decisions and ensure patient safety and quality care through each night. Time to throw in the code pager and head home, a time to relax, exercise, and be with family and friends, as we know that taking care of ourselves is paramount in taking care of others.